Hello everybody and welcome to the Thursday edition of Video Clips, and today I want to offer a couple of perspectives on the annual exam, which I've been speaking out against for a very long time based on evidence. In fact, a growing number of health professionals and organizations are stating that the annual physical exam is useless. And I'll give you a couple of examples. The Cochrane collaboration published a meta-analysis of 14 randomized controlled trials, including over 182,000 people in 2012, and concluded, this is their quote, "General health checks didn't reduce morbidity or mortality, or neither overall nor for cardiovascular disease or cancer causes, although they increased the number of new diagnoses. Important harmful outcomes are often not studied or reported." What they were basically saying is no drop in the death rate, no drop in the disease rate, lots of more things being diagnosed, and potential harms weren't really part of the evaluation. U.S. Preventive Services Task Force says comprehensive routine physical examinations are not recommended for the asymptomatic adult, although many patients and physicians continue to endorse the practice. The Canadian government, well, it's advised against these exams since 1979. They're a little bit ahead of us. The latest person to speak out about the uselessness of the annual exam frankly surprised me. Dr. Ezekiel Emanuel is Vice Provost and Chair of the Department of Medical Ethics and Health Policy at the University of Pennsylvania. He's also been involved in setting government policy as it pertains to healthcare. He's a frequent media guest on the topic of healthcare. He endorses Obamacare. So I don't usually agree with Emanuel, but surprisingly, and he's said some very inflammatory things. You might remember this is the guy who said that he doesn't want to live very long and he'd commit suicide rather than place the burden of taking care of him from a healthcare perspective on others. So full disclosure, this guy isn't always on the right page. But here's what he had to say in a New York Times editorial. He says that not having an annual exam serves two purposes. It can reduce healthcare costs and it can save time and worry since the exam is worthless. He cited the Cochrane study and several others, saying that many studies have concluded that annual physicals don't reduce all-cause mortality and deaths from cancer or heart disease, and it doesn't really matter which diagnostic tests are performed. So people keep insisting the diagnostic testing has become more sensitive and more sophisticated. It doesn't matter. It's not changing anything. What the exams do well, he says, is drive up costs. Annual checkups cost a lot of money, billions of dollars every year. Ezekiel states that the useless practice persists because it's a habit, and it's a habit that's hard to break because all habits are hard to break, and because of stories. Everybody knows somebody who claims to have been saved due to an abnormality detected early and treated successfully. But based on what we know about overdiagnosis and overtreatment, most certainly a lot of these stories are being told by people who really were not sick, and so they were overdiagnosed and treated for conditions that really were not clinically significant. I was frankly surprised that Emanuel stated that thousands of people have to be tested to find a few individuals who really are sick, and even with that sick population, only one or two of those people benefit. And he also mentioned that there's potential harm from screening. There are complications, and again, this overdiagnosis, overtreatment thing is one of them. He states that he hopes more people will join him. He does not get annual exams because it'll free up doctors' time to help people who really are sick. He says we could all contribute to the resolving the issue of physician shortage if we just start staying away from doctors until we really have something wrong with us. I think we don't necessarily have to throw the baby out with the bathwater. The annual exam could be worthwhile if it were restructured. It could be a time to review diet and lifestyle habits, health status like body weight, body composition, and other indicators, and to develop proactive plans for regaining or maintaining health. But this doesn't really fit into our current model of healthcare, so I don't hold out any hope that it's going to happen anytime soon. So, one of my favorite commentators, Dr. John Mandrola, wrote a great piece that was posted on Medscape. His spot-on commentary is so refreshing. I look forward to his articles, and my gosh, if everybody in this country had a doctor like Mandrola, we would be well on our way to solving America's healthcare crisis and all of the financial disaster that accompany it. In fact, we're working on that at Wellness Farm Health. We're trying to train lots of Mandrola-type doctors to join our growing network. One of Dr. John's latest pieces addresses the annual exam. He covers what Emanuel had to say and agrees with him. And he states outright that the annual exam contributes to overdiagnosis, overtreatment, and unwarranted fear. He says that the exam leads docs to look for small irregularities and to take blood tests rather than paying attention to the much more important issues like a patient's weight and overall appearance. Now, he, like everybody, qualifies the statements to say, look, when people are sick, that's a different story. And I've said this many times. If I had an unrelenting pain in my side and it didn't go away in a couple of days, I'd want to go find out what it was. But we're talking about healthy people when we're talking about the annual exam. So Mandrola thinks part of the problem is consumers underestimate, and doctors tend to underestimate, the body's ability to heal itself and to give too much credit to doctors. He also points out that there are some age-related things that you just can't prevent. He cites the example of a 90-year-old patient who has symptoms, shows up in a doctor's office and says he hasn't seen a doctor for 40 years. He says a lot of doctors would say, well, you know, the reason you're sick is because you haven't been visiting doctors. Well, Mandrola opines that the reason this person's probably lived so long is because, quote, he avoided harm from us. I love that. And that docs can't prevent age-related degeneration. He tells patients that, and this is another quote, the first rule of doctoring is that if a patient says she feels well, my main job is to not mess that up. Do no harm, resist the urge. As for unwarranted fear, well, Mandrola says that humans are variable beings and that abnormalities are detected that are, maybe showing up in tests, but not clinically meaningful. So, but more tests are ordered, procedures are done, and so what happens is healthy people are then led to be worried about their health and eventually labeled as sick. And he points out the risks of procedures and tests, which are warranted when you got somebody in front of you with symptoms who's clearly ill, but not so much when you're treating healthy people. And this is his quote about this. I really like it. He says, taking patients who grade their health as an A and making them a D or an F is the ultimate medical error. This is the risk of preventive maintenance. Once in the machine of healthcare, it's hard to get out. That's very similar to the comment that Dr. John McDougall's made for years about people getting into the medical mill. You do not want to get sucked into the medical mill. Now, like me, Mandrola is pretty realistic about changing things. It's really hard to do. But he offers 3 paradigm shifts that we need to make in healthcare for things to be different. And he says, first, we have to acknowledge that good health doesn't come from healthcare. He says, and these are quotes, it comes from good food, good exercise, good sleep, good attitude, and good luck, and that nobody, including doctors, can give those things to anybody. And he says doctors can worsen outcomes when they recommend drugs and procedures as replacement for those good diet and lifestyle habits. Second thing, fearing the right thing. Mandrola says that instead of being fearful that a disease won't be detected early enough, patients should be fearful of healthcare. He instructs patients that the best way to avoid medical error is to avoid health care, to make good choices, and to stop hiring doctors to look for problems. Third, understand the human condition. Humans come in various shapes, sizes, and biochemical makeups, and doctors need to avoid the urge, as he calls it, to look for and diagnose disease when there isn't anything. Stuff that you pick up in tests is not always clinically meaningful. So I've quoted this guy a lot of times in the past. I love his editorials. I think he's a great voice of reason in the sea of medical ineptitude, and it's refreshing that Medscape would even publish information from a guy who's so radical like this. So that's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you again next week with more news.